Greetings, everyone. We would like to welcome you to our live webinar presentation, Health Plan Cybersecurity Trends and Risk Management Response Preparations. Today's webinar is co-sponsored by LexisNexis Risk Solutions. If you were on an airplane right now, you'd need to listen to some safety instructions before the plane takes off. So buckle up and please pay attention to these brief items of note before our webinar takes off today. During the webinar, all attendee lines will be muted. To ask speakers a question, on the left-hand corner of your screen you'll see a blue Ask a Question box. Simply type in your question and press Send. If you need any assistance during this webinar, please contact our Health Web Summit office at 209-577-4888. During this webinar, you will learn about current cybersecurity trends impacting health plans, best practices to consider for health plan risk management response preparedness, and the importance of increasing board and C-suite visibility and awareness of these issues and responsibilities. You will also have an opportunity for interactive learning, participating in a brief online poll on cybersecurity responsibilities. All survey participants will receive a copy of the survey summary report when published. We're pleased to have Alap B. Shah speaking from Epstein Becker Green. Mr. Shah is a member of the firm in the healthcare and life sciences practice in the firm's Washington, D.C. office. Mr. Shah advises clients on privacy, cybersecurity, and data protection laws and regulations. His work focuses on defense and counseling of healthcare entities on legal and regulatory compliance issues around privacy, cybersecurity, and data asset management. So, without further ado, our speaker is now ready to begin.
Hello everyone, this is Alap Shah. I'll be your presenter today, and I'll be presenting on health plan cybersecurity trends and risk management response preparations. We have a lot of ground to cover today, so we'll try to fly through a bunch of key categories of things of interest for health plans. So this is me. I'm a member of the firm of Epstein, Becker & Green. I have some contact information here. If you need to contact me after the presentation, feel free to do so. And just by way of background, I've been with Epstein Becker for about a decade now. I've had 2 stints there, and in the middle of those 2 stints, I've worked as the Senior Counsel and Chief Privacy and Security Officer for ASCO, the American Society of Clinical Oncology. So I've been in the sort of privacy, security, cybersecurity space for the vast majority of my career. I'm happy to talk to you today about some of the things I've learned over the course of my experience. So the agenda for today, it's again a lot of ground to cover, but hopefully we'll do it quickly. First, we want to talk about risk. You need to know what the problem is impacting health plans to really appreciate what the solutions may be. Then we're going to shift gears and talk a little bit about standards that drive the way we need to sort of deal with cybersecurity risk. Then we're going to talk a little bit about governance and what effective enterprise risk management around cybersecurity looks like. And finally, we're going to round out by talking a little bit about the responsibilities that boards and other executives in your organization have and how they may want to carry those functions out. So I'll give you a few examples of best practices there as well. So let's start off with the risk. With regard to health plans, like many organizations these days, data is king. There's lots of sensitive information health plans collect and process to do their work. And increasingly, there's lots of utility to the data sets that are being generated and collected by health plans. And that's true for many other organizations as well. If you look at the largest market cap companies in the world, it doesn't matter where they started. They could have been a web search engine. It could have been a social media platform, a audio manufacturer, or an online marketplace. These all turned into data companies over time, because everyone started to appreciate the value of the data that they were amassing and started leveraging data in very unique ways. And that's true for health plans as well. But with that carries a lot of risk. When you carry that kind of information, personal information, and sensitive personal information, you need to be able to manage risk around that because everyone wants access to it, and some people for nefarious or malicious reasons. Another complicating factor is that we live in a highly interconnected world, and increasingly we have something called the healthcare Internet of Things, where data is being shared and flowing through lots of different places, through lots of different hands, and health plans, again, are no exception to this rule. We're having a greater distribution of networks, data flowing between consumer devices to health plans, either through smartphone apps or web portals, and certainly sharing of data in unique and novel ways, and increasing trends of sharing among health plans and vendors, health plans and providers and consumers. So as the data flows, risk increases, and health plans should be cognizant of where their zones of responsibility are with regard to managing cybersecurity risk. I love this quote, just to sort of set the tone. Our good friend Robert Mueller, I'm sure many of you have heard of him through some of the this president's impeachment processes. Robert Mueller, some time ago, as a former FBI director, had the famous quote: "There are only two types of companies, those who have been hacked and those that will be." And this really speaks to the inevitability of cybersecurity risk manifesting itself for organizations. So let's look at the data. Has that come true? Is that something that we can prove? And to some extent, we have anecdotal evidence to suggest that it is true. When we look at this this chart here, it's a little fuzzy, so I apologize, but it really depicts a few things. This is a depiction of breaches over a certain period of time, and the time period in this slide is from 2009 to 2012. Each circle represents a breach, and the size of the circle represents the number of records compromised. The color coding represents the type of breach, the cause for the breach. And here you can see it's sort of a motley crew of colors, which connotes lots of different reasons. Some of it is lost laptops, for example. Some of it is employee mistakes. Some of it's insider threats. Some of it is hacking from outsiders. So it's really a mix of things we saw. Our experience was that people sort of had security problems across the board in a lot of different ways. But what happened is in 2009 and going forward, we passed the HITECH Act, HIPAA enforcement grew, and people started to really take cybersecurity and security more seriously and started to really solve the problems they could solve for. They started to train their people more rigorously. They started to lock down endpoint devices like laptops, and we started to clean up some of the mess we saw. But what that inevitably led to was the next slide. As we sort of fast forward in time, when we cleaned up all those other issues, we started to see what the real problem was. The hidden problem was that we were having massive hacking events, and that's the purple circles you have here on this slide. This is essentially the world we live in, that there were people who are malicious in nature, hacking into systems, collecting or stealing large quantities of information, financial, demographic, and other, for all types of different gains. We'll talk a little bit about that moving forward. And what's the problem with this? You say, oh, we lost some records. The reality is for organizations, health plans included, there's a real loss of trust that occurs. Here's one example. I'm sure many of you are familiar with the Equifax breach that occurred a few years back. There was a significant financial impact to this company because of what happened. During that September of 2017 timeframe, when the hack was discovered and it was realized that about 143 million records were accessed, shareholders lost trust in this company. And you see this precipitous drop here in that November timeframe, where the company lost about $10 billion in value overnight. And it still hasn't fully recovered, even though it's been several years since this event occurred. So just to sort of put dollars and cents to this equation a little bit, this is the kind of thing organizations may face if they aren't proactive in thwarting the cybersecurity risks they face. Another dimension to look at from a cost perspective is the cost of data breach. And in healthcare, it tends to be the highest. Most surveys, and including the Ponemon Institute's survey in 2019, suggest that healthcare costs around breach remediation and response are still the highest, of $429 per record, all in. When you account for penalties and legal costs and employee lost time, things like that. So the moral of the story here is you really want to try to prevent these things. That'll preserve your reputation in the market, trust with the consumers, and reduce the financial burden that is associated with data breach. And another thing to think about from a risk perspective for cybersecurity is hackers are driven by money. So if you're an organization like health plans are, who collect lots of demographic information about beneficiaries and lots of financial information about beneficiaries, they become a target because hackers really are trying to figure out ways to get money or value out of their activities. When you look at some of the statistics, you see that healthcare companies are certainly not immune. About 15% of breaches surveyed were related to healthcare companies. About 70% were financially motivated, and about 70% were perpetrated by outsiders. So that makes it really difficult because you can't really put too many controls on these outsiders. You really need to keep them out of your networks and out of your data. But the interesting thing is, while 70% were perpetrated by outsiders, there were about 30% or so that were perpetrated by insiders. So you still have an insider threat that you can't ignore either. And we'll talk a little bit about culture of compliance to help with that. And then the types of tactics used, we'll talk about this throughout the presentation. Hacking, certainly, all types of different kinds of hacking, brute force, password spraying, lots of ways to try to crack into systems. Social engineering is a huge one. This is something that we've been seeing a lot of where click on things and get compromised that way. And then there's malware associated with those types of hacks as well, especially ransomware, which we'll talk about as well. And the pain point associated with cybersecurity risk manifesting this way is that oftentimes it goes undetected for long periods of time. So about over 50% of the breaches surveyed in this report suggested it took months or longer to detect. So it really creates real long-term risk for organizations and the people that they serve. And another sort of reason people do this is because medical identity theft is on the rise, and it's used to perpetrate fraud, not only fraud against the federal government from an IRS perspective, but also fraud against the health plans themselves, because you can submit false claims to the federal government or even private payers and see if you can get some sort of reimbursement. And there are certainly cases of that happening. There's also just straight monetization of the data assets that may be compromised. People are selling databases of PII and PHI that have been stolen on the market, and things called fulls and kits are also on the market as well. Fulls being databases of including social security numbers, things like that, to help people open credit cards. Kits are one step further, where people are actually printing falsified documents and selling those to help people engage in identity theft. So again, try to avoid all this stuff, you'll be better off. And if that weren't bad enough, we have nation-state sponsored hacking as well. Many of you have probably heard that there's hacking outfits coming from China, North Korea, Russia, the Middle East, largely motivated, again, for financial reasons, but there are many other motivations as well, especially dealing with proprietary information. So regardless of the reason, it's just another thing to watch out for. And there's certainly government organizations focused on this, and public-private partnerships focused on ferreting out this kind of activity and helping people share information about those kinds of threats. And then, we always talk about hacking as, a malicious person sitting at their computer somewhere in the world, with a vendetta, breaking into a system and stealing things. And that gets a lot of, sort of cinematic and press attention. But the reality is that a lot of hacking is actually automated these days. When you take a look at internet traffic, about only half of it is human. The other half is run by bots, automated processes and algorithms. While some portion of that is doing good things, there's a large and increasing portion of that pie that's doing bad things. And that's going to be exacerbated through malicious use of artificial intelligence as well, is my prediction. So you sort of have these nameless, faceless bots doing bad things, trying to break into systems. They don't eat, they don't sleep. So again, this really, really creates a lot of pain for organizations, because you're on a sort of 24 hours, 7 days a week, 365 days a year cycle trying to thwart these kinds of risks. And in healthcare in particular, we've seen a lot of issues with regard to ransomware. This is more of a low-hanging fruit issue where people are trying to extort money by encrypting systems. They sort of inject the ransomware either through a spoofing or phishing campaign, and then the ransomware goes and encrypts all of your servers, and they ask you for money to give you the decryption keys. There's a lot of pain associated with this. It can really cripple your organization if you don't have appropriate controls in place, like contingency planning, data backup strategies, and things to get back online quickly to get your workforce moving again. And I mentioned this earlier, phishing and spoofing really has taken off. It's pretty rampant these days. And it's not necessarily targeted to health plans, but it's something that health plans certainly have to focus on because it becomes an easy way for hackers to get unauthorized access and credentials to get unauthorized access. So with that, I think it's time for a polling question, Clive.
Yes, this is Clive Riddle, president of MCOL. I'm moderating today's webinar, and as we mentioned, we are doing a cybersecurity poll involved with our research on this. And for all of you the survey responses are anonymous, but for all who click to answer these questions, we'll record just that you've answered, and you'll get a copy of the research report when it's done that incorporates this as well as additional research. So now we're going to start, we're interspersing a few of our questions in different points in the webinar. And we're ready to open this first polling question. And it's going to really come in 4 parts. So if you can remember, we're asking you to rank these 4 types of breaches. And right now we're asking you to rank which of these 4 are you most concerned with of the 4 listed: internal employee hacks, external hacker attacks, external attacks via a portal, or attack via a call center. So if you could answer which of these 4 that you're most concerned with, and then in a moment we'll have you on the next one rank the one you're second most concerned with, and then third, and then fourth. But for now, if you could answer which one you're most concerned with. Okay, and now we can close the first part of this polling question, and we'll proceed to the same question now, asking you to rank the one you're second most concerned with. If we can open this question, and again, is for the one you're second most concerned with, is it the internal employee hack, an external hacker attack, an external attack via a portal or third-party vendor, or an attack via a call center? All right, we can close that question. And now we're proceeding to ask which of these 4 types of breaches you would rank third in your priorities. We can open this question. All right, and finally, we can close that question. And now open the next question, which is just which of these 4 do you rank last? Okay, so that we can close that question, and Alap will take it back to you.
Thanks, Clive. So we did a lot of discussion around what is the risk. There's lots of different risks out there, and certainly not a pretty picture. It is also something that is an evolving landscape of threats. It's not something that's static, so I just want to stress that as a theme for this presentation. This is definitely more of a journey, not a destination activity. This is something where you really need to stay on your toes, because as soon as you think that you've solved for one problem, another problem will pop up, sort of like whack-a-mole. But there are certain cybersecurity standards and best practices that can be leveraged to help you and your organization figure out what's reasonable and appropriate to help manage the risks that you're facing. So let's talk a little bit about some of those. From a 50,000-foot level, one of the things that you should always consider in terms of architecting a sort of practical and compliance program around cybersecurity management is a defense in depth approach. And what I mean by that is you really need to look at, from the top down, the policies and procedures and other sort of organizational controls that you want to put in place to help set the tone for how people should operate, who should be involved, and who's authorized, who's not authorized to be interacting in certain ways in your systems. And once you set the tone for that, and formally so, you want to start operationalizing controls going down the layers. You want to make sure you have physical security around whatever hardware infrastructure you use, and for any of the vendors that you leverage. So if you're using the cloud to build your architecture, you want to be comfortable with what that vendor is doing from a physical security standpoint. And then you just sort of go down the layers. You want to put a ring fence around your network from a perimeter standpoint, like a firewall and other kinds of controls. Then once you're inside the network, you want some controls as well, all the way down to the application layer, which oftentimes is a real point of vulnerability for a number of reasons. Application layers are where people are actually getting access into networks, and that's where we want to really focus on robust access controls. We want to think about what are the authentication challenges we need to have in place to prevent unauthorized access, like multi-factor authentication, for example, and the like. And then finally, don't forget about the data. Even if someone breaks in, there's still ways to protect your data, largely through encryption of data in rest and in flight. So again, defense in depth, there's lots of layers. You want to make sure that you try to hit all these layers with controls that make sense for your organization. So at a baseline level, health plans, among other healthcare entities, have to comply with HIPAA, the Health Insurance Portability and Accountability Act. And HIPAA sets forth the security rule, which has a number of different implementation specifications around preserving the confidentiality, integrity, and availability of data, of electronic PHI specifically. And HIPAA is interesting. It doesn't really provide prescriptive ways to do this. It's more of a high-level, flexible framework, which is good and bad. It allows your organization to sort of determine what's best for your organization based on your size and scope and the nature of what you do. And so I think it's flexible in that way, but at the same time, it doesn't really give you much meat on the bones in terms of how to actually carry out your cybersecurity practices. And in fact, this law was passed, and the rules under the law were passed many years ago without much update. And so it doesn't necessarily account for cybersecurity risk the way that exists today for organizations. But there's a good framework to approach this. The security rule deals with physical safeguards, technical safeguards, and administrative safeguards. I think from a cybersecurity perspective, we really want to focus on 2 and 3 here, especially 3, because most cybersecurity events occur through remote access paradigms. So you want to have robust technical safeguards, like I mentioned earlier. Access control, you want robust access control mechanisms, you want robust authentication mechanisms, and certainly you want auditing on the back end to detect issues quickly if you can. But that's not to say that you don't have administrative safeguard needs as well. Sometimes because of the spoofing and phishing issues that I mentioned earlier, the weakest link is not so much the technical controls. The weakest link is the people in your organization who click on the wrong thing, who put their credentials into the wrong screen, which then allow unauthorized access to your systems. Another key component of HIPAA is that you need to conduct periodic risk assessments. It's a risk analysis and risk management efforts. This is something that the regulators, care very deeply about. Many organizations that suffer fines at the hands of the Office for Civil Rights under HHS do so because they failed to conduct an adequate risk analysis. So I highly encourage organizations to take a look at this and make sure they're doing it. And I think this is also, in line with the theme that I mentioned earlier, which is this is a journey, not a destination. When you think about conducting risk analysis, it's really about an iterative process and taking a hard look at your systems and your organization and improving over time. Another framework that has been really critical to fill the gap that HIPAA leaves because it's sort of very high level and flexible without much prescription is to look at the National Institutes of Standards and Technology, NIST, cybersecurity framework. This came out a few years ago and has been leveraged to really help put more meat on the bones with regard to how to handle cybersecurity threats and do risk management. And I think if you follow this framework, you can start to develop a program that hits those 5 key dimensions that the cybersecurity framework talks about, which is identify issues, protect your system, detect issues that come up, quickly respond, and then recover from those kinds of events. And we'll talk a little bit more about how to measure those things and report out on those things as well. And then finally, there's the HITRUST framework. Many health plans have actually subscribed to this sort of third-party independent common security framework, which brings together a whole bunch of different standards. It was an effort to really harmonize across all these disparate security standards and create something that was sort of a unified view of how to actually create a defensible program. This is something that is not only leveraged by health plans themselves, but I think health plans have leveraged this framework to manage their vendors as well, make it a requirement for vendors to go through the HITRUST review as well. So it's something worth considering if you haven't yet. It's definitely much more prescriptive than HIPAA is, and I encourage people to take a look at it as a way to get into a more secure position from a cybersecurity perspective. And then there's a whole bunch of other resources out there as well. So it's not something where there's a dearth of information. In fact, there might be too much information to digest. I think this is something that people are constantly, again, putting out information, giving people ways to better educate themselves and build more robust programs. So I encourage you to take a look at all this stuff on the list, as some of that may be germane to your efforts to build a compliance program. So I think we're ready for another polling question.
Thank you, Alok. This is Clive Riddle again, and we can open our next polling question. Again, if we can get a click off that you've answered any of our questions. They are anonymous, but we'll be sure to share all the research results with you when we publish our report. And now our question is just to check all that apply of which of these items might drive your organization to sacrifice some security because of these items being a priority. So if you could just check which ones might apply in that situation. So again, you might be checking more than one. Okay, and we can close this question and continue with Alok.
Thanks, Clive. So moving right along, we started by talking about why is this such a problem, What's the risk here? We talked a little bit about, what's out there to help guide us in terms of how to protect ourselves. And now we're sort of shifting gears again. We're talking about the what do we need to do? What do we need to build to really protect ourselves? And that's really about effective enterprise risk management. So what does that mean? It means a lot of different things to a lot of different organizations, and people will approach this problem or these sets of problems in different ways, bringing together different minds in sort of different iterations. So all that said, what I'm getting at is we need some sort of governance structure. We need to sort of formalize who is responsible for managing this kind of risk. And it could be an enterprise risk management committee. It could be an IT security committee. It could be a privacy office. There's lots, again, of ways to sort of skin this cat, so to speak. But what you want to do is you set up this group of multi-stakeholders to come together, sit down, make this an agenda item to talk about, put cybersecurity, high on that list, and figure out ways to develop insight about where your organization needs to be, figure out strategy and tactics to get there, and then track progress against that, and report out to other stakeholders, whether it be your C-suite or your board, or even down towards employees, to help educate them in terms of what needs to happen as a collective. Again, it's about the journey. It's not a destination. That's sort of the theme here. And if you get the right people at the table to take these issues seriously, then you've created, at least at a starting point, a body in the organization to sort of focus on these issues moving forward. And then from there, you can start to really do what's really a critical component for success in the security space, which is build a culture of compliance. Your employees are your security perimeter in a lot of ways. We talked a lot about, compromises due to phishing and other social engineering tactics. So your employees are vulnerable to these kinds of things, and you have a responsibility to empower them to really thwart those kinds of cybersecurity risks. You want to train them. You want to make sure they're encouraged to say something if something comes to their attention. And what you're trying to do ultimately is convert employees from being threats for your organization into being assets and allied partners from a cybersecurity perspective. And training is really, really key for this. You want to make sure you are talking to your employees on a pretty routine basis, training them on a frequent basis about these issues, giving them access to educational materials through learning modules, for example, and specifically talking to them about how they interact with the organization, the systems that they have, and the data contained in those systems. You want to make sure you're very clear about access controls and how those should be used. You should be talking about the devices that are being leveraged in your environment to connect things up, and you want to talk about what to do if something comes up. See something, say something. These are the ways you empower your people to do the right thing when it comes to your networks, your systems, your data, and ultimately your enterprise. The other thing is, as I mentioned earlier, we have increasing decentralization of networks and increasing data sharing among parties. So what happens is that creates what we call an expanded attack surface. It means that where there used to be one door into the building where all of your assets were held, now you have hundreds or thousands of doors in lots of different places, and an attacker or a hacker could come in from any one of those doors and create havoc in your environment. So what you want to do is you want to make it difficult to find those entry points, and there's lots of different layers of controls that you could put in place to accomplish that. You want policies about what should and should not be connected to your network. You want to manage whatever IoT devices are connecting to those networks to understand how data is flowing through those connections. Anything that's coming in that's not your asset, like a bring your own device, smartphone, or other kinds of employee carried devices, you want to containerize them or put mobile device management software on them so that they are locked down in some way. And then you want to make sure you segment the network out so you prevent people from pivoting around if they get into your network. And of course, whatever doors remain, you want to have strong authentication requirements to get through that door. That's one way to do it. And multi-factor authentication really is one of those things that's reducing risk generally. So to the extent your organization can implement that kind of solution to challenge people getting in the door, that's a really good thing to be doing. Back to risk assessment. One of the tactics your organization should do is really engage with security-minded folks to conduct these kinds of activities, because they are foundational in many regards. They help you get insight into where the issues are, and they give you insight into how to correct those issues moving forward. And if you stay with that mindset and iterate from there, you'll always be in a better position than the day before. And that's really what this is about, keeping up with the constantly evolving cybersecurity risk landscape. There are lots of different methodologies to leverage. A lot of vendors leverage NIST, for example, but that's not the only standard. You could, depending on what your organization's regulatory requirements are, you may be looking at international law like the GDPR, the General Data Protection Regulation, or some hybrid of things between HIPAA and GDPR and some other things. So again, this is flexible to an extent. You need to figure out what works for your organization to meet the regulatory requirements you may have. And it's iterative. As you can see from this diagram, it's sort of circular in nature. You figure out what you want to test, you look at what vulnerabilities exist, you assess the risk associated with those vulnerabilities and threats, and then you fix those things and you monitor, and you cycle through that over and over. And it's a continuous, virtuous improvement cycle, essentially. Some practical considerations for doing this, though. I mentioned routine basis. You want to be realistic about the threats and vulnerabilities. This is not a boil the ocean kind of exercise, and it's certainly not one that has to be, done in the abstract. We want to get at the heart of what actually matters for your organization. Every organization is a little different. The risks and threats you may face are different. So be realistic about what it is you think could be a threat to your organization and how you're going to manage that. And then finally, I really, really stress this point. When you do these exercises, you really don't know what you're going to find sometimes. You may find some really red flags, a lot of red flags, big holes in your security architecture. So you want to conduct these things under attorney-client privilege to the extent you can to really prevent people from discovering the flaws that may exist in your system. And then you also ultimately want to create sort of an internal version of your report and an external-facing version of your report, so that ultimately, if someone does ask you to share information about your security posture, you're able to do so without compromising your systems. There's a lot of critical information that is contained in these reports about how you operate, where your bugs are, et cetera. You don't want to necessarily give that kind of stuff up. And the other thing is you want to move from sort of ad hoc processes to formal programs. Your organization can be breached in a number of different ways, and you're certainly going to have finite resources to deal with those issues. As Clive's earlier question asked, what prevents you from making spend on cybersecurity? So ultimately, what that means is that you need to spend your money wisely to put yourself in a defensible position. And the fastest and oftentimes cheapest way to do that at scale is to leverage a third-party security framework, because it's been tried and tested. And that way you can say, some independent organization provided these standards which have been sort of consensus generated and applied them to your organization, rather than sort of randomly making up certain controls by yourself. The ones that I recommend, obviously HITRUST we talked about a little earlier, ISO certification, and the NIST cybersecurity framework are three that I think warrant serious consideration. And so that's all to say you've done your job with regard to your organization, but like I said earlier, a lot of times you rely on lots of other organizations to do your work. And so health plans that leverage vendors need to be thinking about that chain of custody of information as it flows through the vendor's hands as well. So there's a lot of diligence that has to happen with your vendors So you want to make sure that you vet your vendors. You want to understand what their security posture is. You want to contract with them in ways that address security and allocate risk appropriately between the parties. These are going to be critical aspects of managing risk as you engage with third parties. And you also want to conduct tabletop exercises just to get ready. Like I said earlier, there's somewhat of an inevitability that your organization will face some sort of issue over time. And so what you want to do is bring the right stakeholders to the table, test your policies and procedures through a mock exercise, and that way it helps you iron out any kinks that you may have and really identify who has what roles when responding to an issue. And then, of course, if the inevitable happens and a data breach occurs, there are lots of steps that you want to go through. I've laid out a few here. I think it's critical to act quickly and start an investigation and then conduct a robust forensic investigation to get as much information as possible and document the whole exercise so that you can come to a reasonable conclusion about what needs to happen in terms of notification external to your organization. That is something that I also encourage you to do under attorney-client privilege, so engage your legal counsel as quickly as possible so that you can protect your investigation and the documentation created around that. And finally, if you know, you end up having a really bad event and you're going to have an outlay of capital to deal with it, you want to be able to look to some pot of money to make your organization whole, or at least reduce that financial strain. And cyber liability insurance is the way to go. It's a product that's been on the market now and is pretty robust at this stage. So you're going to want to look to have that in your back pocket. And there's lots of different coverages you may want to consider. They're enumerated here. I won't go through them today, but certainly a lot of different types of risk you want to manage with liability insurance. So with that, I think we're ready for the next question, Clive.
Yes, thank you, Alap. And we have a couple questions to ask right now, again, with our research. Right now, we want to ask you, who has responsibility for identity and access management within your organization? And if more than one of these apply, then you could check more than one. So if we can open this poll right now. Okay, and we can close that question, and we have one more to ask right now, so we can open the next poll. What percentage of your budget goes to identity and access management annually? And again, your best guess. And we can ask, is it less than 10%, 10 to 15, 15 to 25, 25 to 50, or more than 50%? Again, your best guess on that. And by the way, I also want to mention to everyone, we will be running the session a little over the 45 minutes, so I want to make sure you know we will still be providing time for questions and answers and for Alap to finish his presentation. So we will be running a few minutes over. But with that, we can close this poll and take it back to Alap.
Thanks, Clive. And I only have a few more slides to go through. I know we covered a lot of ground today, but I thought this is a really important piece of the puzzle. So, we talked about, risk. We talked about how to solve for risk, and build an organizational program to deal with it. But one of the things that's increasingly important is to make sure that the boards of your organizations are adequately aware and empowered to direct your organizations the way they need to solve for these cybersecurity risks. And that means resourcing appropriately. That means making sure it's a priority in your organization from the top down. So what used to be an issue that lived in the the IT department's hands solely and was dealt with sort of in the shadows of your organization is now bubbling up and being brought to light to the highest level decision makers. So to level set, in terms of a board's responsibility around cybersecurity, there are a lot of organizations and federal agencies that have come out and basically said boards do have cybersecurity obligations through their duty of care and their duty of oversight. And there's been litigation around this issue as well, and sometimes board members have gotten into some trouble for sticking their heads in the sand with regard to cybersecurity issues. So how do we protect our board members and empower them to do the right things by our organizations? We want to make sure we solve for one critical issue, which is boards generally have lacked visibility and awareness of organization cybersecurity posture. And to fix that problem, we want to be able to bring these issues to light for them and give them information in a way that will help empower them to make decisions about how to direct the organization and resource it appropriately. And one of the ways to do that is to really develop key performance indicators around cybersecurity that you can bubble up to the board as needed on a frequency that makes sense for your organization. And I'm going to give you a couple of examples of how you might want to think about creating that kind of reporting for your board so that they can start making decisions that they need to, or at least gaining the awareness they need to so they can understand enterprise risk. So this dashboard is just a mock-up, but was developed around the NIST cybersecurity framework standards. So it's bucketed into the 5 dimensions I mentioned earlier: identify, protect, detect, respond, recover. And under each one of these verticals, there's a lot of different aspects that you could think about creating metrics around. For example, for identify, there's this at the very bottom of it says software inventory. Software inventory is something that having awareness about can help you reduce risk that there might be some malicious software in your environment or some unapproved third-party software that's running that could create risk, for example. Protect, for example, user training is one of those things on the list in the protect bucket. And that's something where you want to be able to report out that you're doing a good job with training your staff. And there's metrics you can showcase around that. So on and so forth. And so there's, again, for your organization, you may have different metrics than others, but worth thinking about how to measure your success or lack thereof and show it to your board so they understand where time, energy, and money should be spent to help improve the security of your organization. And here's a few examples of metrics. I mentioned a few before, but one of the things, for example, here on this slide is event investigation, and the specific metric is the percent of security events defined and investigated per the policy. So help the board understand how many times does your organization face these kinds of things in a specific period of time. And you'll have a defined sort of trigger for that to say, okay, we define security event as X, and every time we see X, we'll log it and we'll show that we've had one of these events. That way the board can understand, okay, well, in a given quarter, we have 3 or 4 of these things that we need to spend time and money and effort to help respond to and fix. These are the kinds of information that a board should be aware of so that they really can understand how to direct their organization. And then finally, you want to roll it up and report out on progress. So similarly, you may have different dimensions you want to report out on. This is just a mock-up slide to help you think through it, but some dimensions I thought are, done typically is around access control. Who has access? Do you have a way to manage access control? Encryption. How many laptops in your organization are encrypted? How many are not? So what's the vulnerability there? And then how many people are trained, as I mentioned earlier. So there's lots of ways to roll this up. There's lots of ways to display your success or gaps that you have, but ultimately it's something that's really important to do to protect your organization and protect your board to have awareness. So with that, I'll pass it back to Clive for, I think, the final polling questions.
Yes, thank you, Alap. And we have 2 final questions, and then we'll get to audience questions. And right now, we can open this poll. We want to ask you, going from this year to next year, is your budget expected to increase significantly or increase slightly, stay the same, decrease slightly, or decrease significantly? If you can prognosticate on that for us. Okay, and we can close that question and go to our final question, which is, what's your level of confidence in your current authentication measures, to prevent unauthorized access via a patient or provider portal or a mobile app? Are you confident, cautiously optimistic, or, concerned? So we're just trying to characterize, how you feel about that. If you feel you've got the necessary controls in place, you'd be confident. If you are cautiously optimistic, you feel you have some controls in place and haven't detected a breach, but realize you could add more controls. Or are you concerned that you feel that possibly some controls are outdated and you might be in the mindset it's not where it's not, but when we might experience a breach. So we can answer this final question. Okay, and with that, we can close our final poll. And we're going to some questions for you, Alap. And the first is, what is your general impression of health plan board awareness of cybersecurity issues and responsibilities? Do many have a lot of catching up to do, or are most plans where they need to be from your perspective?
Yeah, it's a good question. It's a little bit all over the place. And I think, it has to do with the fact that this is a sort of newer area of risk to manage, and it's a rapidly evolving area of risk. Cybersecurity threats and compliance around it is something that's hard to keep up with. And with that said, I mean, a lot of organizations, even more sophisticated ones, are still, it's like flying a plane as you're building it. On the one hand, you have very sophisticated organizations who've been able to throw resources at this issue and have created mature governance and ways to bubble up these issues to their board who take it very seriously. And that's, similar to what I showed you in terms of these dashboards and things at the very tail end of this presentation. But on the other hand, there are many organizations that are much less mature, and they're dealing with things on an ad hoc, sort of reactive basis. Oftentimes, the boards are unaware of what's happening, and oftentimes, the only time a board would hear about issues is when you have a security incident or a security breach, and there's no other choice but to sort of bubble it up to the highest levels of the organization because there's significant reputational risk, significant financial risk to deal with. So I think that we're all on this learning curve going up. And one thing also to add is that there's always room for improvement. Even if you're, on the sort of higher part of the curve, the learning curve, it doesn't mean that you're done. You sort of have to iterate on these things, and it's about the journey, not the destination. Okay, and we have time for one more question, which one of the audience wanted to know. Given that health plan information sits on the desktops of thousands of providers and the information can be easy to hack, why haven't providers instituted more available solutions to prevent this on behalf of their providers? Yeah, that's an interesting question. Also, I think that this is a challenging. This is challenging. We talked a little bit about the sort of decentralization and sharing of information between payers and providers, both of whom are regulated by HIPAA and many other data protection laws, have their own independent obligations to protect this information. So there's sort of two things to think about. One is it really a payer's responsibility to manage the risk that's borne by a provider who may host health plan information? And I would argue that it's really not the payer's responsibility. The provider has its own independent obligations to protect that information. So, and risk associated with that. So that's number one. I guess number two is, okay, so let's assume that providers have obligations to do this. Why haven't they themselves, the providers, instituted, practices to prevent unauthorized access? And that goes back to my issue of healthcare cybersecurity maturity generally, which is healthcare as an industry writ large is pretty far behind in terms of cybersecurity preparedness as compared to many other industries like the financial sector, for example. So you end up having a lot of practices, provider practices who just are not sophisticated enough, who don't understand the issues, who don't have the capital to spend on these types of activities. And so they're going to be vulnerable. There's no way around it. And hackers are pretty lazy, for lack of a better way of saying it. They're looking for low-hanging fruit. And so they will pick off those providers who are just totally unaware or unprepared to deal with it.
Well, thanks a lot. And with that, this concludes our questions. And I want to thank you a lot. You've covered so much ground in a short amount of time, and I thought it was a very excellent presentation. And also want to thank all our attendees for attending and for participating in our research as well. So I also want to mention that we will be sending out an email to all attendees, giving it the opportunity for feedback and to ask any additional questions that come to mind that we will forward on to all. And so thank you again, everyone, for attending. And this now concludes our webinar.